How much should a dental office spend on supplies and labs? All right, are you excited about this topic? Because I know I am. Who doesn't get excited about supplies and labs? This is like the most exciting thing on YouTube, right? Tongue in cheek, obviously, but I actually am very serious. If you're buying a dental practice, this is a super important question to understand, because dental supplies and lab expenses are one of the bigger expenses in your office. How much you spend on these things directly affects how much money you take home, how well your office is run. It affects patient care, the type of work that's going into patients' mouths. This is a big deal. So I get excited about this topic because I actually do think it's fun. The answer to the question of how much a dental office should spend on labs and supplies is typically between 11 and 12% of collections. So if a dental office collects an even $1 million, and I opened up that office's profit and loss statement or tax return, I would expect to see that office spend $110,000 to $120,000 a year on labs and supplies. So 11 to 12% is typical, but there are a few caveats. Specialty offices sometimes have a little bit different number. If you're an orthodontic office, you're obviously going to spend more on supplies than a GP office. If you're a pediatric dentist, you're going to have almost no lab bill whatsoever. So the 11 to 12% number is very true for general practice offices and directionally true for specialty offices with a little wiggle room. So 11 to 12% is the magic number for well-run dental practice offices. I do see time to time practices that spend less than 10% of collections on labs and supplies, but it's very rare for me to see 8, 7, 6, because there just is a fundamental give and take between standard of care and how much gets spent on labs and supplies. So shoot for between 11 and 12 as the magic number for what you can consider a well-run dental practice. Why this number gets me excited is labs and supplies is the biggest expense in a dental office that's variable. Now, fixed versus variable expenses is something I learned in my accounting program. All that really means is that the costs of supplies and labs go up and down based on the amount of dentistry being done in the office. So unlike, let's say, staff or rent, some other bigger expenses that tend to be fixed, variable costs go up and down in direct proportion to two things. First, how much dentistry you're doing, and secondly, how well you manage those expenses, something we're going to talk a little bit more about in this video. Variable expenses are a big deal because if you were to look at a dental office that you're interested in and you see higher than average overhead, and you remember from another video, we're looking for overhead to be around 60, 61, 62%. Let's say you're looking at an office that's running 65% overhead. It's less profitable than you wished. If you go in and look and you see that dental supplies and lab fees are higher than you'd like to see, and that's the cause of the high overhead, as a buyer's rep and as an accountant, I tend to get more excited about that than I do where the rent is really high or the staff costs are really high. Because staff costs and rent and other fixed expenses in a dental office are nearly impossible to change. So variable expenses are an accountant's dream because they move in direct proportion to the amount of work you're doing and how well you manage them. So I get excited about labs and supplies because it's variable, which means you have control. You control the amount of money being spent in this area, and you can manage it well or manage it poorly, unlike something like rent that is just fixed and you have to take it as is. So think of yourself in the driver's seat of someone looking at a dental practice for sale. You analyze the labs and supplies, you do the math, and you figure out the number. And for this example, let's say the number for both categories put together is 15% of collections. Now you, as the buyer, have some intelligent questions you can ask the seller, the broker, whoever's involved in answering the questions for this dental office. If you're looking at the office, you can ask the question, hey, tell me about which lab you use. Who does the ordering of the supplies in this office? How often do you order? Do you ever negotiate? When was the last time you changed supply reps? What you're trying to get to is you're trying to get a sense of, are the supply and lab bills in this office high because this office just uses the very most expensive composites and labs and the highest quality materials? Or, more commonly, are the expenses high in this office because no one's really manning the ship. No one is really in charge of the ordering in this office. Therefore, the Shine, Benco, and Patterson reps are really excited to come visit this office because they know they're going to get a little higher payday than they do at some other offices around the place. So what seems like a really boring topic like supply and lab bills actually gets pretty exciting when you start to understand that as the buyer of a dental practice, you have some control over the numbers here. That after you buy this practice, you can move your own profitability up and down based on how well the practice is run today. If the practice is well run today, fantastic. That's amazing news for you. You should continue doing the things that the seller and their staff were doing in regards to the expenses around labs and supplies. If the labs and supply bills are higher than you want them to be as an owner, that's not bad news either for you. It requires a little more work, might require a bit of a culture change in the office in terms of how often you order and where you order from, but it's something inside of your control. So lab fees, dental supplies, magic number between 11 and 12% of collections for most offices. And if you ever need to understand the specifics of a dental practice you're looking at, and you want to just check your math and see that you're doing it right, reach out. I'm more than happy to help. You can reach me on the website, dentalbuyeradvocates.com, schedule time with me. You can check out the book, the free podcast. There are a ton of resources as you start to explore this issue and others. Best of luck.